Alright guys, so let's continue from where we left off the last time. So we were talking about the hair and its structure. And we mentioned the hair bulb, we mentioned or we're actually talking about the follicles, my bad. We were talking about the hair bulb, the layers, and um the goosebumps from the erector pili muscles. So let's take a look at these pictures. So um, this is from Grey's Anatomy, and so the names will be different from what we call them nowadays. But so this central layer is called the medulla of the hair. This next layer is called the cortex, and the outer layer is called the cuticle. And these three layers are of the hair itself. So everything that you see on the outside um, is has these three layers. But these three layers are actually in the inside, and they are part of the follicle of the hair, not the hair itself. Now, these two layers, what Grey's Anatomy calls Huxley's layer and Henley's layer, are actually part of the inner root sheath. This outer layer is part of the external root, so internal root sheath, external root sheath of the hair. And then after that, you have this thing called what is called the hyaline layer here. It's actually more commonly known as the glassy membrane now. So this is the basal. So um, these um, these four layers right here, or these three layers actually, are part of the epidermis. So if you take a look right here, the epidermis folds in, right? So these layers right here are actually part of the epidermis, are extensions of the epidermis. Now the outer layer is actually part of the dermis, and it is a surrounding connective tissue layer, or surrounding um, dermic coat. Now, this is just another picture of it. So there's the medulla, there's the cortex, there's the it doesn't show the cuticle, but the cuticle is very thin, so don't worry about it. So then there's the inner root sheath, outer root sheath, and the glassy membrane is really thin, so it's not in there either. But then after that, you have this connective tissue outer layer right there. So now let's talk a little bit about um, hair growth. Now, I'm not going to go into detail. I'm just going to give you the basics. If you want to take a look at this picture, I think you should just search up the hair cycle, and you should find this somewhere. But what happened? So the first thing is hair growth. So anagen is what it's called. There's this growth phase that goes on for a while, and it depends on the type of hair and where the hair is located. Now, the next phase is catagen, which is a regressive phase of hair. So the hair stops growing, and the bulb starts to um, what's the word that I'm thinking of? The hair bulb starts to shrivel up, as you see right here. And then after that, telogen happens. So it's just resting phase. Nothing's happening really. So then after that, it goes back to anagen again. And telogen, I know, is around 1 to 3 months. Um, so the types of hair. So there are two types of hair. There's vellus hair, which is found all over your body, that thin hair. And then after that, there's the fine hair, thin fine hair, and then there's terminal hair, which is the coarse, thicker hair, stronger hair, which you find on your head and you find in your armpits. Um, so now let's go back to hair growth again one more time. I forgot to mention this. But hair growth is affected by many factors, but health is a major one. So homeostatic imbalances of hair, excessive hairiness, hirsutism, sorry, is in women can result from tumors of the adrenal gland or the ovarian tumor. And these tumors cause those areas to, or the ovarian, I shouldn't say ovarian tumor, actually, it should say, it may result from a tumor in the adrenal gland or a tumor in the ovarian area. And so what happens is those tumors allow the areas to secrete a lot of androgens, and these tumors are usually surgically removed because I don't think there are I don't think there are many women that want an excessive amount of hair, and I'm talking about excessive amount of hair, not like So let's continue talking about hair. So hair thinning and baldness. So alopecia. So That's just hair thinning after age 40. So I mean it's normal. It's not like you're like completely balding. It's just hair thinning after age 40, and vellus hairs start replacing the old terminal ones. And alopecia usually starts anteriorly and it heads all the way back. So then after that, the next one is true or frank baldness. And one form of this, which the book mentions, is male pattern baldness. So this is basically caused by sex linked traits. You can search that up. But what it eventually does, there's a gene that activates a different response to. It's called dihydrotestosterone, which is a form of testosterone. And you'd think usually that testosterone will increase will stimulate hair growth, but in this case, the response of the gene makes the hairs respond to it in a different way, and so hairs don't even get out of the follicle even most of the time. Um, so treatments for this are what used to be just inhibition of inhibiting testosterone. But then after that, uh, there are a few more drugs that can help. So minoxidil, which we use for hypertension, has a side effect of hair growth, but it results may vary from person to person, so it's not really a certain thing. And then after that, there's finasteride, which you have to take once a day, and it works. But the thing is, you have to take it every day, and if you forget to take it, what all your hair is going to come out, even the hair that even hair that stay even old hair, all of it's going to come off. So you gotta be careful with that. So let's talk about some homeostatic imbalances. There's hair loss, which can be caused by hair loss can be caused by fever, emotional trauma, or drugs. But it can also be caused by protein deficient diets. So because you need protein to make that keratin. Then there's alopecia areata, which is an autoimmune disease, in which the immune system thinks that the hair follicles are a threat, and so it attacks the hair follicles. But the follicles survive in all of these cases, allowing hair to grow back. So now let's talk about the functions of the integumentary system. So some integumentary system functions. So protection. So there are three forms of protection in the integumentary system. There are chemical variables, chemical barriers. Sorry, not variables. Chemical barriers, physical or mechanical barriers, and biological barriers. So chemical barriers include acid mantle, which includes all of the chemical secretions of the skin. So your sebum, your sweat, they have a low pH, which prevents bacteria from growing. So then there's human defensin, which is a natural antibiotic. It punches holes in the membrane of bacteria. And then there's when you're wounded, your body can secretes these proteins called um, cathelicidins, I think is what they're called. Um, and they help fight against a specific form of staphylococcus, I think. Or no, is it staphylococcus or streptococcus? I'm not quite sure. Um, Streptococcus. Okay. Then there are physical barriers. So the epidermis and the waterproofing glycolipids, they help for their physical barriers, but it's really not, honestly, it's physically it's not that tough. So that it has to work hand in hand with the acid mantle to prevent things from going in. But there are objects that do penetrate the skin to an extent. So lipid soluble substances, so oxygen, carbon dioxide, vitamins A, K, E, D. Then there are oleoresins, which are little resins secreted by plants, for example, poison ivy. Then there are organic solvents such as acetone. Then there are salts of heavy metals such as lead or mercury. And then there are drug agents called penetration enhancers, which um, help transport drugs into the body. Now, a homeostatic imbalance to mention would be the organic solvents and the heavy metals. And geez, I have so many spelling mistakes in this presentation. Oh well. So organic solvents and heavy metals can cause kidney failure, brain damage, and it can cause a lot of other damage to the body as well. So anemia, for example, neurological defects. So um, you shouldn't you shouldn't handle those with your bare hands. So let's continue those integumentary system functions. So you have temperature regulation, so sweat when you're hot, and that the sweat's caused by vasodilation, which increases the metabolic activity of the skin, which causes sweat. So whenever you're hot, sweat evaporates, which dissipates the heat from the body. And then if there's vasoconstriction when you're cold. So when you're cold, the hot blood um, is only limited to the area, um, the dermis really, lower dermis, because the vasoconstriction, um, because the constricts the blood vessels, preventing it from going up higher in the skin. So then there's cutaneous sensation. So the Merkel discs and Meissner's corpuscles sense soft sensations, so like caressing or soft touches. Pachynin receptors sense pressure and harder sensations. And pain is sensed by free nerve endings, just meandering throughout the whole integumentary system. Now let's talk about vitamin D production. So that's a metabolic function of the integumentary system to produce vitamin D. So blood flows through the dermis, through the skin, and when the sun hits it, um, when radiation hits it, there's this modified version of cholesterol within the blood. And when the sun hits it, it converts to a precursor to vitamin D, which is eventually converted into vitamin D, which can be used by the intestines to take in calcium. So let's talk about some more functions. It's also the integumentary system is also a blood reservoir. So the dermis holds around 5% of the blood's volume. So whenever other organs need that blood, the um, the vessels are constricted in the dermis, and the blood is directed to those organs rather than the dermis. So and then finally excretion, which really is an important function of the integumentary system. It's something that the integumentary system does. So some nitrogenous wastes such as urea, ammonia are secreted through sweat, but most of those are secreted in urine. Really the only waste that it secretes it would be your sweat, so the salts and the loss of water, and that's more of a negative loss though. Anyway, um, we're done with part one. So thanks for watching, everyone. Hope to see you next time.